Hi, Dr. Henry. I'm just wondering, a lot of people rely on these numbers on a daily basis, have quite an interest in them, and I'm just wondering how it is that the data was so wrong for Fraser Health for so many days.
Well, this is the travails of our IT systems and the fact that we've increased capacity in our lab by bringing in other labs that have interoperable, supposedly, systems. So a patch was put on one of the systems over the weekend, and the anomaly was only detected yesterday. So it is one of those things. I obviously would not want it to happen. We know that the people who were tested and tested positive were notified, but there was a gap in when those reports came in to the IT system at the health authority. So it is something that happens. Obviously, we don't want to, and that's why we're talking about it today, because people do put a lot of stock in the numbers on a day-to-day basis, as do we. And we also look at things, though, and it is a caution in a sense in that the numbers in any one day reflect a lot of things. They can reflect an outbreak. If we look at the north, for example, there's one large outbreak that accounts for about a third of the active cases right now. So, that is active case finding once somebody's been identified in a common area. We see that with long-term care, with the hospital outbreaks where a whole bunch of people are tested. There's another large industrial plant outbreak in Vancouver where we've had dozens of cases who've tested positive on a day. So, the daily numbers tell us a little bit. They tell us how we're doing overall. But what we also look at are the 7-day rolling average, we call it, and that's posted it has been on our dashboard, but it's not as prominent. So we'll put that up as well, so you can understand a little bit about trends over time rather than, what does a number today mean. What this does tell us, though, is, if we look back on it, our peak numbers in the 800s were actually last week, and yesterday's number was slightly smaller. Doesn't change the fact, though, that we are in a very critical time right now, and we are seeing far too many people being infected with this virus, and that's now being reflected in our hospitalization and people in ICU.
Do you have a follow-up, Bender?
Yeah, just so on that, just wondering how that sort of figures into when you're looking at why the cases in Fraser Health continue to soar. I know we saw spikes after Thanksgiving and Halloween. Just wondering, is Diwali a factor here? And are you considering declaring Surrey a hot zone, as others have done in other parts of the country, and perhaps bringing in different restrictions there?
Yeah, so the second question, no. We look at a whole bunch of things. So some of the data that is not reported on an ongoing basis is what Justine Hunter asked about. What are the outbreaks? What are the linked cases? So we are not seeing cases related. We've seen a decrease in cases related to and outbreaks related to parties and weddings and Diwali. We've not seen a surge in people at those types of celebrations, so that is a positive thing. What we are seeing is that surges, and we're picking up and detecting clusters in outbreaks in other settings now. So that's come down. We're now seeing that second phase, and if you remember the graphics where we had a person who went to a spin class and then it spread to a bunch of other people and they went to workplaces. So we're now at that, there's clusters in workplaces that we're detecting. So we do look on that at that in public health on an ongoing basis. So we have a pretty good idea where transmission events are happening. That's why we've put in some of the restrictions we did on indoor group fitness activities, for example. We put restrictions on, and we closed down eventually, nightclubs and certain bars and banquet halls, because those were the settings where we were seeing lots of transmission happening. Then we saw lots of private parties and people not following the gathering rules at weddings and birthdays and other things, or parties in people's homes. So we do look at that in some detail, and even today we had some discussion about where we were seeing and what other measures might be needed in different parts of the province related to where we're seeing transmission events happening. So it is very detailed behind the scenes that is sometimes not able to be reflected as well in just the numbers.